Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers, and today we're talking about the impacts of abortion bans on live births and infant deaths. Researchers Alison Gemmill and Suzanne talk about their new study that looks at the real-world consequences of abortion legislation in the first 18 months after the overturning of Roe v. Wade. Let's listen. Alison Gemmill and Suzanne, thanks so much for coming back on Public Health on Call. Today, we're talking about some new research you've done about the impact of abortion bans. But first, I want to back up a little bit. We had you on the podcast last year, and we will link to that episode in the show notes, to talk about some other research you did. And I think that builds to what we're talking about today. So, Alison, do you want to give us an overview of that work?
Sure. So our original work looked at the impact of a specific Texas policy known as SB 8, which was one of the first major abortion bans in the country and occurred prior to the Dobbs decision. And because the Texas policy was implemented nearly a year before Dobbs, we were able to investigate the impacts of that policy first. And we did so by conducting two separate analyses leveraging birth and death certificate data. So the first analysis looked at what happened to the number of live births after the policy, and then the other was to look at what happened to infant mortality. And so in our analysis of fertility, we found that the policy was associated with an almost additional 10,000 births in the state of Texas through December 2022. And then with infant mortality, we found an unexpected increase in infant deaths of about 13%, whereas the rest of the U.S. didn't experience that increase. And then in that same infant mortality paper, we noted some suggestive evidence that the increase in infant mortality appeared to be partly driven by an increase in deaths due to congenital birth defects.
And can you explain why that was significant?
Yeah, so the reason why we think we saw this increase in congenital birth defects is because if a couple in their anatomy scan detected a fetal anomaly, then that couple had the option to terminate prior to abortion bans. And so now we think with abortion bans on the table, or with the abortion bans in place, the option to terminate is off the table, which requires, again, birthing couples to travel out of state to receive care, and not everybody's going to receive that care. And because of that, or as a consequence, we think we're seeing people carried essentially doomed pregnancies to term, and they're delivering babies with severe defects that are very incompatible with life, and that's resulting in an infant death.
And so now this new research builds on some of this previous work that you did, and we're going to get to some of those specific results. But first, can you walk us through how you approached it this time, Suzanne?
Yeah. So Alison's provided a great summary of some of our research to date, and the effects of recent U.S. abortion bans on fertility and infant mortality, though, we're still unclear, particularly this question of how specific populations may be differentially impacted. And so our two recently published studies provide the broadest evidence to date of this unequal impact of abortion bans across and within states and subgroups. And to address this question of the variability in the impact of abortion bans on fertility and infant mortality, we used, again, birth certificate and death certificate data, as well as census data from 2012 through 2023 for all 50 states and the District of Columbia. And to analyze these data, we used Bayesian panel data model to estimate how abortion restrictions affected the rate of live births and infant mortality in states with complete or 6-week abortion bans. This method allowed us to estimate what live births and infant deaths would have looked like if these restrictions had not been in place, and compare that to what we actually observed. In addition to studying what happened to fertility and infant mortality overall, we also then estimated effects by subgroups, which is a key contribution of this research. And we were looking in the fertility analysis by age, race and ethnicity, marital status, education, and whether the individual qualified for Medicaid as a proxy for income. And then for the infant mortality analysis, we looked by race and ethnicity, the timing of the death, whether it was in that first 28 days of the neonatal period versus after, and the cause of death, congenital versus a non-congenital cause of infant death. And for states with abortion bans in the exposed time periods, This expected fertility and infant mortality rate in the absence of the exposure is essentially the model prediction based on the observed rates for states with abortion bans during the exposure period, as well as states without abortion bans over the entire study period.
And so can you tell us a little, Suzanne, about what you learned about fertility? And I'm assuming here you're speaking about live births.
Yes. So we estimated there was an estimated one additional live birth above expectation per 1,000 reproductive age females in states following the adoption of these abortion bans. This is a 1.7% increase, equivalent to more than 22,000 excess births by the end of 2023. And this indicates that approximately 10% of abortions that we think would have occurred in these states during this time period ultimately resulted in a live birth. And impacts were largest among racially minoritized individuals, so non-Hispanic, Black, Hispanic, and other racial ethnic groups, those without a college degree, Medicaid beneficiaries, unmarried individuals, younger individuals, those less than 35 years of age, and those residing in southern states. And when we looked across states, the estimated changes in fertility rates above expectation ranged from 0.3% above expectation to 2.3%, with the largest estimated changes in Texas at 2.3%, Kentucky at 1.4%, and Mississippi at 1.4%.
And what do we know about why this is happening?
Well, to Alison's earlier comment, the assumption here is that these individuals, and in particularly those experiencing the greatest structural disadvantages, are unable to overcome the barriers imposed by these abortion bans and are forced to continue an unwanted or unsafe pregnancy to term, resulting in higher fertility in these states that have imposed these bans.
And let's look at another dimension of your research. So, Alison, do you want to speak to the infant mortality data that you have?
Yeah, so I mentioned our earlier work in Texas where we found this increase in infant mortality. And so one of the questions that we had with Dobbs was whether we would see this increase in infant mortality in other states following the Dobbs decision. And so our paper came out that did indeed show a 6% increase in infant mortality among states with bans. And this corresponds to an additional 478 infant deaths above what we would have expected in the absence of these bans. So again, we're finding similar patterns that we found in our initial Texas paper. But in this paper, we also were able to look at specific states that were impacted. And we found that this largest increase in infant mortality was concentrated in Texas, but also Kentucky. And in both of those states, we found about a 9% increase. And then we found that in general, these increases were concentrated in southern states. The other thing that we did, which is a contribution of this work, is we were able to look at infant mortality among racial ethnic groups. And we found that there was an 11% among non-Hispanic Black infants in terms of their increase in the infant mortality rate. And what was really striking was that this increase in Black infant mortality was consistent across states with bans.
So we know that there's an increase in births that happens when these abortion bans go into an effect. And based on your past research, we know that there's also this increase in infant mortality. What do these findings tell us about abortion legislation itself? And Suzanne, maybe you can pick up on this.
Yeah, I mean, I think together these findings really confirm hypotheses and some of our prior work in Texas that indicate many pregnant people, as I mentioned earlier, were ultimately unable to overcome barriers to access abortion services and instead were forced to continue unwanted or unsafe pregnancies to term, including doomed pregnancies diagnosed with fatal anomalies. So even the, Herculean efforts that many abortion groups have taken and continue to take to support pregnant people accessing needed abortion care out of state, that has not fully offset the demand for abortion or need for abortion among people residing in states that have imposed these abortion bans. And importantly, we find the effects of these abortion bans are not uniformly felt, with the largest estimated impacts among populations experiencing the greatest structural disadvantages and in states with among the worst maternal and child health outcomes. And importantly, these populations, many of whom already have worse pregnancy outcomes to begin with. And with regard to the fertility findings, I think it's important to situate these additional births, even those that did not result in an infant death, in the context of a large body of literature demonstrating that not being able to obtain an abortion has negative physical, mental, and economic implications for birthing persons, their children, and their families, and can undermine achieving health equity. And our infant mortality results I think suggest abortion restrictions may be stopping or even reversing improvements in infant mortalities that have been made in recent decades, with the greatest harm and undue suffering experienced by Black infants, as Alison highlighted, and infants born in the South. And I think another piece that is important to contextualize the impact of abortion legislation and the findings we have here is that even prior to these abortion bans and restrictions imposed following the Dobbs decision, the states that imposed abortion bans had much worse maternal and infant health outcomes, with many counties in these states considered maternity care deserts, situation that is only worsening in recent years. And our findings suggest these disparities across states worsen when restrictions are imposed on reproductive autonomy.
I want to go back, Suzanne, to something you said here about the unwanted aspect of this, because some might argue that the intended outcome of an abortion ban is more live births. But can you expound a little bit on, you're talking about health inequities. This isn't just more babies being born.
Yeah, and I think that's where the results that we have here highlighting the unequal impact of these abortion bans are really valuable in understanding that it is populations that are already at greater disadvantage that are being forced to continue these pregnancies that in the absence of these bans might have otherwise been terminated. And thinking about these additional births in the context of research like the Turnaway study, where we see there are harms done to families that are struggling with an unplanned birth, not only physically for the birthing person that is exposed to the risks of continuing a pregnancy and labor and delivery, which important to think about this in the context of the maternal health crisis that we have in the U.S. in general, let alone in the context of a pregnancy that otherwise would have been terminated and has much lower risk to the pregnant person. And then also that there are additional impacts on existing children of these families. Most people having abortions already have children, and these extend to the mental health and economic health of the family as well.
I think the Turnaway study gives a lot of really great context to what you're saying, and we will certainly link to that in the show notes. And you talked about that in the last episode too. Now, when we last talked, the research that you had done at that time said, well, what do you hope to learn more next? And that is the conversation we're having right now. And so I'm going to ask that question again, now that you know that this is not just a problem that is limited to Texas, it's not just a problem that is limited to specific groups, what do you hope to learn more about? What other impacts can you dig into? And Alison, I'm going to have you pick up here.
Yeah, so it's really exciting to see all the work that we're doing finally come to fruition. And we're hoping that actually some of the work that we're working on currently will be coming out this year. And that's going to be on the maternal side of things. So obviously in the national conversation on this topic, there's been a lot of discussion and discourse around what's happening with pregnancy-related care and potential negative consequences for maternal mortality and maternal morbidity. And so we're actually looking at both of those outcomes right now. So with the maternal mortality data, we're using death certificate data. And for maternal morbidity, we are using a variety of sources, but one of those sources includes hospitalization data, which we think is close to the gold standard for measuring severe complications of pregnancy. And it's important to look at those complications because we estimate that for every maternal death, there's about 100 cases of very severe maternal complications known as severe maternal morbidity. So we'll be looking at that. One other thing I wanted to highlight is with our infant mortality findings, we find an increase in the infant mortality rate due to congenital anomalies. But what was really striking to me was that we also found an increase in deaths due to non-congenital anomalies. And that could include things like maternal complications, but also potentially infant accidents and infant suffocation. And so we were a little bit restricted in the way that we could analyze those other causes of death because it's such a rare outcome. But if we can somehow look at infant morbidity in a way that can shed additional light on what's happening with infants that are potentially suffering as a consequence of these abortion bans, and it's not just a story about congenital anomalies or defects. I think there's a larger story there about these negative spillover effects happening to both mothers and their babies. And so that's something that we hope to disentangle in the next year as well.
Thank you. And Suzanne, anything you want to add to that about your research?
I think we've contributed a lot, and we're excited about the work in the pipeline. And yeah, to Alison's point, I think the infant mortality is really just the tip of the iceberg in terms of infant outcomes, and we're looking into that further.
Great. Yeah, this is a really important part, as you said, of the national conversation on these topics, and we will absolutely check back in with you again. Thank you so much, Alison Gemmill and Suzanne Bell.
Thank you, Lindsay.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.